dear nurses, this is Bijada from Athena Coaching Center, and this video I am going to discuss how to answer the questions which are frequently asked upon all nursing licensing exams. So, are you really preparing for nursing exam? If yes, you can watch this video completely. Here is the first question.
Yesterday we have this on nicotinic acid for hyperlipidemia, and the nurse provided instructions to the client about the medication. Which statement by the client would indicate an understanding of the instruction? So client is admitted with hyperlipidemia, it's increased cholesterol, where client is on nicotinic acid, that is a choice of medicine, and the nurse provides instructions to the client about medication. Which statement made by the client would indicate understanding of the instructions? That means when patient stated, there are four statements by the patient. One of the statement is indicating the teaching session was effective. That means regarding nicotinic acid, the patient stated a particular thing and that is normal for the normal regarding the instruction. So A says it is not necessary to avoid the use of alcohol, and B says the medication should be taken with a meal to decrease flushing. Clay colored stool are common side effects and should not be concerned. And ibuprofen taken 30 minutes before nicotinic acid should decrease the flushing. So what is nicotinic acid? Yesterday I have explained to you. Nicotinic acid is vitamin B3, fine, and it is normally used to reduce serum cholesterol. So other name of nicotinic acid is niacin. So niacin can be given as a choice of treatment for hyperlipidemia, fine. And see, in case of niacin deficiency, what is called as what is niacin deficiency? Vitamin B3 deficiency is called as pellagra. Okay, so even the same kind of medications can be given in pellagra, and it can be given in malabsorption syndrome, a patient who has been continuously using alcohol, but only the difference is the dose may be slightly varied. Okay, so the dose will be slightly varies according to the indications, fine. So it can be given in hyperlipidemia also, and then it is given in a malabsorption syndrome, metabolic disorders, a person who is taking alcohol, and pellagra situations. Okay, and how do we administer this medication? Normally this medicine is taken 1 to 3 times daily, that means TDS. Usually it is divided dose, and there are certain kind of side effects which are very commonly expected. One of the side effect is gastric upset and flushing. Flushing is commonly expected, so gastric upset and flushing, fine. So when you give instructions before giving medications, you need to ask the patient that flushing is a common side effect, and that can be treated by giving ibuprofen. That can be the answer. And there are certain kind of food that reduces flushing, for example, apple sauce. Okay, on there are certain kind of fruits that will reduce the flushing. And see, when a person who is taking nicotinic acid, they have to reduce alcohol consumption, should not take alcohol. And again, there are certain kind of medications that get always altered the absorption of medications. For example, NSAIDs, allopurinol, aspirin. Okay, so these medications alters the absorption of medication. And see, when you are providing nicotinic acid for a patient, It is not mandatory to administer any other lipid lowering agent. For example, when a patient who is taking already cholestyramine never administer niacin, or a patient who is taking niacin should not administer same kind of medications like a lipid lowering agent. Okay. And when a person who is taking medications, it should be continued. Never stop the medications without doctor's order. Whatever the medications that is taking, the continue the medications till the till further order. Fine. So these are the certain things that you need to remember. And one more thing, while administering these medications, you should be very conscious, or you should be very clear that the patient is not having any kind of gout, diabetes, gallbladder disorders, liver disorders, because there will be chances to get alteration in all of these parameters. Okay, so it's something very important. And alcoholism or drinking alcohol, it's something it should be avoided, and NSAIDs should be avoided, aspirin should be avoided, and flushing is a common side effect and that need to be treated. Okay, so yes, so please now you can select the answer.
A. It is not necessary avoid. Sorry.
See, A is it is not necessary to avoid the use of alcohol, necessary to stop the alcohol. So A is wrong. We want a correct statement. Yes. A is wrong. And B, the medication should be taken with a meal to reduce flushing. It's not correct, because flushing is an expected thing. Clay colored stool, that is not something related with this. And ibuprofen takes 30 minutes before nicotinic acid should decrease the flushing. Yes, that can be the
D answer.
yes. Next question. Next question, a client has developed a paroxysmal nocturnal dyspnea. Which of the following medication does a nurse anticipate will be prescribed by the physician? So the patient has developed the paroxysmal nocturnal dyspnea. What is paroxysmal nocturnal dyspnea? It's breathing difficulty while sleeping or while in a supine position. Okay, so that is paroxysmal nocturnal dyspnea. So paroxysmal nocturnal dyspnea is expected in which condition? Tell me, paroxysmal nocturnal dyspnea that is expected in which condition? Yes, it's expected in congestive cardiac failure, mainly left ventricular failure. Okay, so now you can, it's indicating left ventricular failure, like paroxysmal nocturnal dyspnea, which is a usually medications that is given in left ventricular failure. Sorry, paroxysmal nocturnal dyspnea is a situations where it is expected in left ventricular failure. So what medications you can give? Yes. Select. Interval, Bimax, xylocaine, streptokinase or streptase. See, you can remove wrong answer and then select the correct answer. See, mainly in case of left ventricular failure, it is indicating pulmonary edema. Mainly, so paroxysmal nocturnal dyspnea is indicating pulmonary edema. Now you can select the answer. In pulmonary edema, what is the choice of medications? Yes, anyone? See, it's normally we give diuretics for the patient in order to remove the entire thing, entire extra fluid. So you can administer a loop diuretic. That is one. There is one medications which is considered as a loop diuretic. So what is that? It's Bumax. So Bumax is considered as loop diuretic. So the answer for this is B. Next question. "66-year-old client complaining of not feeling well is seen in clinic, and the client is taking several medication for the control of heart disease and hypertension. These medications include tenormin, digoxin, uh, dura- diuryl, or chlorothiazide, and a tentative diagnosis of digoxin toxicity is made. Which of the following assessment data would support this diagnosis?" See, digoxin is a choice of treatment for congestive cardiac failure. And again, the person is admitted with congestive cardiac failure. And here they have not mentioned congestive cardiac failure. They said like a heart disease and hypertension. So it can be a disease, any kind of disease where the patient requires digoxin. So patient is receiving digoxin, and you need to select the side effect of digoxin. So you can write down the side effect of digoxin: bradycardia, yellow halo vision, confusion, bradycardia, yellow halo vision, confusion, anorexia, vomiting. Okay, so now select the answer. A is dyspnea and edema palpitation, so that can be removed A, and B is chest pain, hypertension, and paresthesia. It's not something related with this, and double vision, loss of appetite and nausea, and constipation, dry mouth, and sleep disorder. So out of this, the correct answer is C. It's double vision, vision changes, and loss of appetite is anorexia and nausea. So these are the side effect. And one more thing you can just remember, it is hypokalemia increases digoxin toxicity. Hypokalemia increases digoxin toxicity. Okay. So next question. Client is being treated for acute congestive cardiac failure with intravenously administered Bumax. Vital signs are given after the initial dose. Which of the following is the priority assessment? So you can select the answer. Yes. Okay, options are not visible. Yeah. Monitoring weight loss and monitoring urine output and monitoring blood pressure and monitoring potassium value. A patient is who is receiving Bumax. It's loop diuretic. Yes, we got.
Answer is C.
And so monitoring blood pressure. I got answer. Yes, Eliama. This particular option, it is not for this answer. Ibuprofen is not NSAIDs. Yes, Eliama,
D.
can you please
Potassium level. Monitoring
for this
potassium
answer?
level.
D. The answer of this question is answer D. Monitoring potassium level.
Potassium level. Okay. See, what is this current situation is like the patient is receiving ibuprofen, like Bumax, and it is like a loop diuretic. So when a person who is receiving loop diuretic, look at the vital signs too. You have to check weight, yes. You have to check urine output. You have to check BP. You have to check potassium. And my question is, which of the following is the priority assessment? That means initially what you assess. All these four are necessary, but initial thing. And when we compare with the vital signs, now only the patient's BP is 100/60. So above, along with this BP, if you give medications, it could cause again further hypertension. So better first what you need to do is check BP and then go for potassium level and urine output and weight. Clear? So the answer is not D, it's C. Eliamate ഒരു ഡൗട്ട് ഉണ്ടായിരുന്നല്ലോ ഇനീഷ്യൽ അത് ഏത് ക്വസ്റ്റ്യനിലായിരുന്നു ഞാൻ ചെക്ക് ചെയ്തില്ലായിരുന്നു ഞാൻ ഇപ്പോഴാണ് ചെക്ക് ചെയ്തത് what was that doubt? Ibuprofen is not NSAID. Can you say it this?
Yeah, madam, അത് ഇത്
ഏത് ക്വസ്റ്റ്യന്റെ
36 ഹൈപ്പർലിപ്പിഡീമിയയില്
ഫസ്റ്റ് നമ്മൾ ഡിസ്കസ് ചെയ്ത ക്വസ്റ്റ്യനിലോ ഓക്കെ ഓക്കെ എന്തോ
NSAID
ഡൗട്ട്
അല്ല.
പറയൂ ഇതാണ് സ്ക്രീനിങ്
ഐബുപ്രൂഫൻ NSAID അല്ലല്ലോ ആണല്ലോ അല്ലേ?
NSAIDs ആണ് അതെ.
അപ്പം പിന്നെ
NSAIDs ഞാൻ അവോയ്ഡ് ചെയ്യണമെന്ന് പറഞ്ഞത് കൊണ്ടല്ലേ?
തന്നെ.
ഓക്കെ, വേറെ ഏത് ഓപ്ഷനുമായിട്ടാണ് കൺഫ്യൂഷൻ ഉള്ളത്?
അതേ ഉള്ളൂ, NSAID ആണ് ചേരുന്നത് അതാ, പക്ഷേ ഐബുപ്രൂഫൻ
ibuprofen, yes, ibuprofen NSAIDs ആണ്. Exactly, NSAIDs see, NSAIDs has various impact. It reduces pain, it causes bleeding, and it has anti-pyretic action, anti-inflammatory action. അങ്ങനെ കുറേ actions ഉണ്ട്. അപ്പം ഈ ibuprofenന്റെ സിംഗിൾ ആക്ഷൻ ലൈക്ക് ആന്റി പ്ലേറ്റ്ലെറ്റ് എന്ന് പറഞ്ഞൊരു ആക്ഷൻ ഉണ്ടല്ലോ, ആസ്പിരിൻ, ആ ആക്ഷൻ ആണ് ബേസിക്കലി ഈ മെഡിസിനുമായിട്ട് ഒരു ഇന്ററാക്ഷൻസ് ഉണ്ടാവുന്നത്, ബ്ലീഡിങ് ഉണ്ടാക്കുന്നുണ്ട്. മനസ്സിലായോ? അപ്പം അതുകൊണ്ടാണ് നമ്മൾ അത് ഒരു കുറെ ഇമ്പാക്റ്റിൽ അങ്ങനെ ബേസിക്കലി നോക്കുമ്പോൾ ഈവൻ ദിസ് ഇസ് ഓൾസോ നോട്ട് സേഫ്. See, whenever the person who is taking this medications causes flushing, so it is not completely recommended that every time e patient ibuprofen edutittu medicine edukku. It is not highly recommended, but out of these four options we can select only one thing. Okay. Because of the conjugation effect aanu. Clear ayo? Okay, fine.
Thank you, madam. Clear ayi.
Okay. Next question number 40. Intravenous heparin therapy is ordered for a client. While implementing this order, a nurse ensure that which of the following medication is available on nursing unit? Anticoagulant. The patient is receiving heparin. So while a patient is receiving heparin, what medication you should keep aside? So you can keep aside is antidote. So it's protamine sulfate. Okay. Yes. So the antidote of heparin is protamine sulfate. And what are the other anticoagulants other than heparin?
Warfarin.
Warfarin. So what is the antidote of warfarin?
Vitamin K.
Vitamin K, very good. Any other anticoagulant? Aspirin can also be act like. So what is the antidote of aspirin? Activated charcoal. So 3 antidote we have learned: heparin, protamine sulfate, warfarin, vitamin K, aspirin, and activated charcoal. What is the antidote of morphine? Naloxone or Narcan? What is the antidote of digoxin?
Digibind.
Digibind.
Digibind. Is there any other word? It's immune fab. Okay. Next, iron. So you can make a note. Iron. What is antidote of iron? Desferol, yes, or desferoxamine. Okay. Magnesium.
Calcium gluconate.
Very good. Calcium gluconate. Diazepam. Flumazenil. Acetaminophen.
N-acetyl.
Mucomix, yes. Or N-acetyl cysteine. Okay, and potassium. Potassium antidote. Have you heard about what is that called? K-bind? Kexalate? Kexalate. Kexalate. Or there is another other name also. It's sodium polystyrene. Polystyrene sulfonate. So there is spelling error. It's REN. Polystyrene sulfonate. Okay. And what is the antidote of lead? Dimercaprol. Beta blockers. Antidote of beta blockers is glucagon. What is the antidote of mercury? Same, dimercaprol. What is the antidote of insulin?
Glucose.
Insulin. Yeah, exactly. Glucose. Opioids.
Narcan.
Yeah, it's naloxone or Narcan. And anything else? Yeah, anticholinergic kind of medication.
Atropine.
Yes, anticholinergic is atropine. Okay. What is the antidote of benzodiazepines? Benzodiazepines. Same thing. Diazepam.
Flumas.
Same antidote of diazepam. It's flumazenil. Okay. Okay. Fine. So please learn these are the frequently asked antidotes. Next question number 41. A diabetic patient calls your clinic and reports her insulin is clumpy. You advise her to. First one is shake the vial vigorously to resuspend the insulin particle. Second is warm the vial to room temperature to see if the clumps disappear. And third is discard the vial and open a new one and gently roll the vial between her hands to rewarm the solution and resuspend the insulin particle. Yes.
Answer is C.
Answer is C. It's discard the vial and open new one. Yes. Exactly. Exactly. So answer is C. Okay. Clumpy എന്ന് പറയുമ്പോൾ എന്താണ് ചെറിയൊരു sedimentation പോലെയുള്ളത്. Okay. So you should not use the clumpy kind of vial. You have to discard it and buy a new one. Okay. And my next question is, where would you administer insulin? Where is a better site for administration of insulin? Or what is a route?
Subcutaneous.
Simple. Sub-Q. Position.
Abdomen.
On abdomen. On the thighs. On the forearm.
Forearm.
Okay, fine. So my next question is, when a person who is receiving insulin, they may need to take the insulin thrice a day or four times a day, at least twice a day. And there are certain situations where single time taking insulin, but insulin need to be taken for a longer duration. So you need to continue providing insulin. So it is something mandatory. Fine. So my question is, continuous administration of insulin could cause a complication or a side effect. What is that? Prolonged taking insulin. Continuously, if a person who is receiving insulin could cause only the insulin administration.
Tissue necrosis.
Yeah, it's something tissue necrosis, but it is exactly called as lipodystrophy. Okay, so it is considered as lipodystrophy. Fine. So fine. So that need to be avoided by how can we stop that, or how can we prevent that?
Change the positions.
Yes, anatomical site rotation is very important. Anatomical site rotation is very important. Fine. Before giving injection, how do you clean the area? What solution you would use for cleaning? Yes, please.
Normal saline.
Normal saline or in like spirit? ഇഞ്ചക്ഷൻ കൊടുക്കുമ്പോൾ നോർമൽ സലൈൻ വെച്ചാണോ ക്ലീൻ ചെയ്യുന്നത് ഓർ സ്പിരിറ്റ് വെച്ച്
alcohol soap.
alcohol
Alcohol.
and then what is the ankle for administering injection ankle at what ankle you will administer 90 45 10 to 50 60
10 to 50.
yes this is subcutaneous so what could be the ankle
45.
it's 45 okay
45.
it's 45 but you can administer even in 90 also because insulin usually we load in a insulin syringe and insulin syringe are specifically designed to administer only for subcutaneous area so even if you use 90-degree also it will only reach up to the subcutaneous area it will not extend up to muscles okay so you can administer 90-degree also but when we learn like a subcutaneous ankle is like a 45-degree okay so next question what is the side effect of insulin what is the side effect of insulin
Hypoglycemia.
exactly it's hypoglycemia how do we prevent hypoglycemia when a patient who is receiving the insulin you have to closely monitor what is the sign of hypoglycemia after insulin administration and you need to make sure that the patient eats adequate amount of food after receiving insulin fine and the insulin should be taken before half an hour before food but you need to make sure that whether the patient is receiving adequate amount of food after taking insulin and see there are different kinds of insulin and based on different kinds of insulin the peak level of action is also something different and you should know what is the peak level of action and when would the patient develop hypoglycemia so in that particular area or at that particular time they can eat some kind of snacks in order to prevent and there are certain situations where hypoglycemia is expected very rapidly for example a person when who they are doing activities and when they are doing any kind of exercise okay so these are the in case of like not eating food or skipping food these are the situations where hypoglycemia is expected so identify the risk factor and treat the situations okay when we discuss endocrinal system we'll discuss everything in detail and next I'm moving to next question see why I'm explaining each and everything while the question discussion session it is like a revision so someone whom they are listening for the first times but don't worry we will discuss each and everything in detail when we discuss the topics like respective topic but still I'm continuously explaining and that is always helpful for exam takers okay so those who are booked for exam this will be considered as a very good thing and it is like a revision okay fine
By the end of this question discussion, I hope everyone have understood how to select the correct answer and how to remove the wrong answer. And if you are really interested to appear exams, you can join us and we provide regular and crash online offline batches. And you can contact us in this number 7736360007